our Navigator Advisory Committee. I think we have a forum. I want to first welcome everybody and thank you all individually. I'm not familiar with a lot of these faces, so we'll get to know each other a little bit. But I want to thank you for dedicating your time to this. I know you were kind of volunteered by different organizations, but it will be a worthwhile activity, I think. We'll try to be as efficient about it as possible, respectful of everyone's time. So with that, if I could ask CJ to do the roll call.
Dina Schmidt.
Here.
Art Remp.
Here.
Mike Murphy. Ms. Bogart. Mr. McEverly. Mr. McEverly, are you in Las Vegas?
Oh, I'm sorry. So,
sorry, CJ. Yes, Brian McEverly.
Thank you. Ms. Butler.
Here.
Mr. Ramirez. Mr. Downey.
Here.
Ms. Ford is not in attendance today, and Chair Johnstone.
CJ, we also have Maria Gutierrez.
Excellent, thank you.
And we have Sophia Long with the Attorney General's office to serve as our deputy for this advisory committee.
Excellent, and we have a quorum.
Thank you. If we could just go around the room, being that it's our first meeting, if you can just let the record reflect who you're representing and your interest on the committee, if you want to express that as well. Maria, I'll start with you. You can turn on the speaker.
Okay. Yes, hi, I'm Maria Gutierrez, Salamanca Insurance Services, and I am part of the association with CCA HU, and I'm here representing the broker community.
My name is Brian McEverly. I'm also from the Clark County Association of Health Underwriters, also representing the broker community, seeing how we can just improve the enrollment process and just make it more efficient going forward. Anything I can do to help. So.
I'm Randall Downey. I'm here from CARE Nevada. I'm an EEF, and I second Brian's remarks. I'm here to help improve the system and increase our enrollment.
Up north.
Art Remp with St. Mary's Health Plans. I think my purpose here is the same as already been introduced. We want to see what we can do to help our members.
Thank you.
I'm Dina Schmidt. I am a program specialist with the Division of Welfare and Supportive Services, and my role would be to help provide information about the Medicaid enrollment process.
Thank you. I don't think your microphone is on.
All right, am I there? Test one,
there.
Two. I'm Grace Butler, and I'm with ACS Insurance, and I'm an independent broker. And I am just representing, obviously the brokers, and hopefully we can all come to some ideas of making this work better for all of us.
Thank you. Well, I hope that with the mix of committee members being from the broker community, the enrollment eligibility facilitators, as well as the state agencies that are involved and the carriers, I think we've got the right mix here that we can have kind of a real productive conversation amongst us about constructive suggestions that we will have for the board. And so again, I welcome each of you. At this time, I will open it up for public comment. Is there anyone in the north?
It does not appear so.
Thank you. Anyone in the south? Thank you. All right, I'll close public comment. So in terms of the roles and responsibilities of the advisory committee, you know, last year when we were getting the exchange rules and operational guidelines put together, we formed several advisory committees. And what that did is allow some dedicated time to speak to particular issues. At that time, I don't think we imagined exactly how it was going to work with the enrollment eligibility facilitators and or the brokers, because we were trying to get people trained on a system, we were trying to get plans established, we were trying to decide who was going to be the enrollment eligibility facilitators and how that process would work, trying to get all the brokers through the certification process. And so we know a lot more about how your business is impacted by the decisions we made about the exchange and how it's been set up. And even if we had the right intentions, what problems you're currently experiencing. And we do hear quite frequently from your counterparts at the board meetings, but generally during public comment. And so it just isn't a forum that is easy to go back and forth on the discussion about developing recommendations. So really that's why we kind of carve out the role of an advisory committee to get that added input. So it will be, I'm hoping that we can think 2 or 3 meetings maximum. So today what I was hoping to get out of it is recommendations in certain areas, discussions and recommendations in certain areas that are currently going on that impact you. And then the next meeting would be thinking about the 2015 process. So, Andre, let the record show Andre Ramirez is here from the Ramirez Group. We're just talking about the purpose of and the responsibilities of the committee. So we will be having 2, maybe 3 meetings, depending on how the discussions go, and then we'll bring those recommendations forward to the board for their action. If there are quick items or there are urgent items that we're ready to make recommendations, we don't have to wait until we've gone through everything to make those recommendations to the board. We could bring them forward as we see fit if that seems appropriate to the committee. And Dr. Ford is the other member of the Silver State Health Insurance Exchange that is also serving on this committee. It is a little bit hard for her to break away from her practice when we don't have a lot of notice about when the next meeting is going to be. So she wasn't able to be here today. We'll try to plan this a little bit further out. Maybe she can accommodate the schedule. So all the frequent board meetings for the exchange have been difficult for some of the members that have a day job that just really doesn't accommodate schedule changes. So with that, any questions from the board or the committee rather? Okay. Anybody up north have any questions, or we can just dive into the agenda?
No questions.
All right. So CJ, I'm hoping that you can help out on some of these agenda items. CJ Bowden is the Public Information Officer for the Exchange, and I think is very familiar with all of you. He's probably one of your main points of contact with the Exchange. So the first item is discussion possible action regarding specific functionality of the Nevada HealthLink web portal, and just really wanted to, hopefully in a organized manner, hear directly from you some of the specific functionality issues that are affecting the enrollment of the members. We think we have a pretty good list, but I think it would be helpful hearing it directly from those that are working with it every day. And in this discussion, if we can, to the degree possible, hold it to what's currently not working well. Hopefully that means that things that were a problem are no longer a problem, and the list is shorter. But regardless, if we can talk to it from the standpoint of what's currently not working well. So I'll just open it up for discussion. Randall?
Thank you, Madam Chair. If I may, I have a couple issues. I helped lead the library project for CARE in 12 different libraries in Clark and in Nye County. And there were a number of issues in the border towns. And I'm speaking here specifically of Laughlin and Mesquite. And one of them, I'm not sure if this is a part of the system functionality or not, but access to services. In Medicare, I know the Advantage plans will allow people in those locations to access care in St. George or in Bullhead City, Arizona. And I've not been able to receive cogent answers from the plans as to whether that's available to those individuals here. One of the difficulties is that the practitioner search engine is difficult to navigate. In fact, it's almost impossible to do a quick or even a moderate search to help identify practitioners for individuals, especially in those areas. Originally, there was such a tool, but it was inaccurate to a high degree, and it went away. We're now offered the paper documents or the online copies of the paper documents from the plans, and I would urge that consideration be given to allowing us some kind of searchable engine to help individuals and families identify who their practitioners in that network might be. Two other issues regarding the border towns. It was a particular note, and this may just be a curious fact, and so Ms. Schmidt, I direct this, I guess, to you. When you're trying to enroll a family or an individual in Laughlin, if it proves that they are in fact Medicaid eligible, the only plan that appears removes them from Clark County. So they're not offered a health plan of Nevada or the AmeriGroup. It shows they are resident not in Clark or in Washoe County. And I'm not sure if that makes a difference. Possibly it's sorted out at the Medicaid welfare offices. I do not know. I just raised it as an issue of concern because it was certainly of concern to families and individuals in that situation attempting to enroll. Finally, during this interim period, HealthLink has been kind enough to furnish our EEF organization at CARE with a number of names of individuals. But because I surfaced people in Nye County and in the border town areas, often, many of them, we encountered system errors that left them hanging. Or they became so frustrated they didn't show up for a return appointment. And I'm asking if there's some way, maybe CJ, you could help in this regard. You could make those, is there a way to access outstanding accounts that were not completed in those specific areas? And I refer here specifically again to Laughlin, Mesquite, and in Nye County, Pahrump. If those names of those families or individuals or open accounts could be forwarded to our organization, I'm sure the Ramirez Group would second this. We'd be more than happy to assist them to complete their application and finalize their enrollment. As we proceed in the interim period here, we are now entering the final phase of trying to resolve many of those open accounts that were not complete. But we're going to be moving into two separate areas in this later interim period before open enrollment. The first issue I'd like to raise is about the qualified life events. Using the call center to assist these families and individuals is proving to be quite cumbersome. Is there a way that we can enter a code to allow a new application to be processed. That's one issue. The second is, can we have an accurate list of what those specific qualifying life events are? I've not seen a complete list on the HealthLink website. I've accessed a number of others, and I help individuals and families judge whether they may be eligible using those materials. But it would be extremely helpful if we could have that on the HealthLink website so that people could access that ahead of time, and it would help move the process forward much more quickly. For example, I was just approached by a small employer outside of Boulder City. It was a casino property. They just changed ownership. The new ownership said to the employees, "We will offer you a new health plan beginning April 1st, 2014. Those employees did not avail themselves of Nevada HealthLink. They've now been offered that plan. It appears to me at first glance that it is a substandard plan. It does not meet the essential health benefits required. They are therefore coming to our organization for assistance. And again, if we could have an easier way to help process these people through and enroll them into new health coverage through HealthLink, it would be much desired. Thank you.
Thank you very much. That was a long list, as I suspected. Let's try to take this one at a time, and CJ and maybe the rest of the exchange staff could help as possible. If there's an answer that we could address today, or if we need to do some more research and bring it back to the next meeting, let's say that. So the first issue I wrote down was access to the services in the specifically Laughlin and Mesquite areas. And I think that that is something that the certification of the health plans is needing to review what standards there are for the providers per population. And that's kind of in the Division of Insurance hands, to my knowledge. CJ, is there any direct input that the exchange has on that process?
That is under the network adequacy standards, where the care is available and how far a person has to drive for care. Of course, as things progress and things move on, we're hoping that the carriers bring a wider network for the products, but right now that is just a complaint-driven system for network adequacy at this point in time for access to care.
Yeah, just having been in the health insurance business for a while, those rural areas are always going to be difficult. You hear this from Elko and Ely and Tonopah, any rural area. So it's very difficult. So I don't know that there's, we can make a note of it, but I don't, as an issue, it will be looked at. I just don't know if there's something that we can, as the exchange, do about that. Okay. The second item I wrote down is that the provider list is hard to do any kind of search function, or you cannot do any kind of search function on it, and difficult to navigate. And CJ, I don't want you to have to speak for Xerox, but do you know where we might be in the process of having search capabilities on the provider list?
On that issue, the provider search function was disabled in January of this year due to the fact of it had quarterly updates. There was a subscription service used by Xerox to supplement the BOSS system, and those were updated on a quarterly basis. For the start of some of the plans, there was wrong information in some of those plans. It would have been updated in January, but the entire portion was pulled down because of the errors in the system, and many of the plans felt that quarterly updates were not quick enough. So to change that, we would need a recommendation to the board to bring back the search function by provider, and we would have to look at possibly using a different updating system or different subscription system to make sure that we got the correct information from the carriers on a monthly basis to put that in and put that together.
Thank you. CJ, do you know if the carriers, and maybe Art could speak to what St. Mary's Health Plan does, if there is a link directly to the carrier, are there search functions at that point that the individuals could access?
Do I need to state my name for the record, Art Ramp? So, so there's a link on when you go through the enrollment process on Nevada Health Link. There's a link from there that will link you to our public website that gives you a PDF of our directory. So, so you can see member, or you can check for providers on that PDF.
And that's the point where, other than a search for a word, potentially, there's not a search function per se on a PDF document that they'd get to.
I would have to go back and check to see. I think right now, though, it's just a PDF.
Okay.
But it is a specific directory for just the exchange, and it's labeled as such. And just to comment on one of the things that CJ said, when we were asked to provide our provider directory, it was 6 weeks before the beginning of the quarter, roughly, is when we had to submit it, and it wouldn't go up for another 3 months. So the directory at that point is about 4 months out of date. And provider directories change on a weekly basis. And from a carrier perspective, that was the reason why we felt that, doing it quarterly was just not adequate.
Yeah, I think as one board member, I definitely appreciate that from my days at the state employee benefits program. And so having a link to the carriers is probably going to be the most practical way. I just don't know, CJ, is it a PDF document with the other carriers as well that they're referred to?
Each carrier has their own features. On the PDF document, the only way to search it would be to use the Control F function, and some of those are searchable, some are not. But each carrier has their own setup, and we link to the site that the carrier refers us to.
Okay. And Brian?
And this may be, Brian McEvoy, this may be kind of a simplistic IT question, but for example, is it possible, and obviously this question's probably been asked before, when someone clicks on whether it be St. Mary's or Anthem or Nevada Health Co-op or Health Plan of Nevada, that once they look at the provider directory, it could simply be dovetailed, of course, to the carrier itself's website, which most of those are interactive, where you can look up based on zip code. Is it something that's just not that simple based on the way the HealthLink is set up, where they could just be fired directly to the carrier site once they ask the question about providers? Or
Are you referring to then being able to enroll directly at the carrier site?
No, just if you're on Nevada HealthLink, and obviously you have a question about, let's say, Anthem or Nevada Health, whichever carrier, and you click on provider directory for, say, Health Plan of Nevada, you're not enrolling with them, and I understand that completely, but to go to their site where, of course, you can then go to an interactive where you can look it up based on zip code. Is it not something that simple that can be done?
Well, that's what I was hoping, but I was hearing that the carriers are providing not necessarily an interactive
Right, that's what
provider.
I heard what Art said. I just didn't know if that's something that's just too difficult to do, and maybe it is. Because as a hard copy PDF, it's not searchable, and as Art mentioned, if it's sent that far ahead of time, it's outdated the day they print it, basically. Just out of curiosity. Like I said, it may just be an IT issue.
So maybe it's a question from this committee to the carriers, if that's in their plans at all, to make the provider directory searchable.
Yeah.
So Brian, if I understand this correctly, this is Andres Ramirez for the record. Currently, most of the carriers, I know that HPN and Anthem already have a searchable provider directory for the plans they sell off the exchange.
Right.
I don't know. I know they're providing a PDF because they don't have them flagged on the provider directory, which one of those providers also service their exchange plans. But if they did that, then we can just embed their search page into the NHL website so that we wouldn't have to create something else. And as each carrier updates, we're just
It's
viewing
automatic. It's exactly
an embedded window of what their search page is. Is that what
I
you're...
would think that would solve the ongoing issue of constantly making corrections. Therefore, it's automatic on the carrier side. It's also automatic on the link side. There may be a reason why carriers are not doing that, and I obviously don't have the answer to that. But I know just from a broker perspective, we're on those sites all day long looking up doctors for clients, and we do it in our sleep. It would seem to make it easier on both sides. And once again, there may be a reason why they don't. I don't know that. But yeah.
But that's, I just wanted to
Yeah,
confirm
right, yeah,
that's what
boom,
you were
yeah.
looking, okay.
As they update it, boom, it's on the site, good to go. You know, so just a suggestion.
All right. So Art, as a carrier on the committee today, can we ask you at least to ask your organization if there's any technical reason why that couldn't be done?
Yes, I can do that. And this is Art Ram, just for one other follow-up comment to this. It really would be most beneficial if this is integrated within to the enrollment process. Because for us as a carrier, we need to know who the PCP that the person picked was. And if they go to our site, they look up who the PCP is, they either need to bring back a number that will match our system, or they need to have the spelling for the provider's name entered into a free text field in the enrollment process, which is challenging because the doctor's name is Robert and they put Bob. It doesn't match our system. We have to manually process that claim. It's slow, or that enrollment. It's not efficient to do that. It really does need to coexist inside of the enrollment process. Go to a database that they click on it. It populates from that, so there's no hand keying of any data to make it most efficient, so it comes through correctly to us.
That's understandable. CJ, do you know if there were any discussions about including the PCP information in the enrollment?
On the original functioning of the provider directory search, a person would go in and they would be able to select, click on that, and it would auto-populate with the number. But when that provider search was taken down, that whole feature was taken away. So a solution to that would be to look at and ask Xerox. It would be a contract change and a contract amendment, but we could ask Xerox to reinstate the provider search tool and update on a monthly basis. That would, using information from the carriers, that would put the same system back in place where we could track down the PCP at the time of enrollment and get that information over on an 834.
That's an option. I wonder if there's an even more technical approach where it doesn't have to reside at all in the Nevada Health Link and it could be brought over somehow. I don't know if that's possible. That seems too simple. But we could ask Xerox to look at both of those options. Any other comments?
Well, theoretically, if each of the carriers on their search engine database, Andres Ramirez again for the record. So if I'm searching, as I do with HPN or others, and it pulls up all that doctor's information, it pulls up a code, they could essentially create a virtual V card that can be transposed over to the HealthLink so that the data doesn't exist on the HealthLink side, but by copying the link, you could be able to transport that data over to an application file, but that would put the burden on the carriers to have to create those copying V cards to be able to transfer over to the application. Right.
All right, so it would take some work, but there might be a way to do it. I just always worry about thinking that we're going to be able to keep the list in sync, because I do appreciate that they change pretty frequently.
For the record, this is Steve Fisher. Would a monthly update, Art, would that be sufficient? Or I know you said those things change on a weekly basis. Even 1 month might not be sufficient enough. I'm not sure if we were to go down that path, if that's sufficient enough for the carriers or not.
Art Ram, yes, we had talked about that, and monthly at a minimum would be okay.
And then to answer your question about the technology, it sounds like it's an external service that the Nevada Health Link is accessing for this service or to get this information. I think maybe reaching out to that service and finding out a little bit more information about what they can do with regards to keeping that information updated on maybe a much more keeping it updated much more often. I don't know. I mean, they must they must be getting the information from the carriers, right? Or
Right. So what we heard was that there was going to be an additional cost to do more frequent updates. And so that was why it was not done, because of the additional cost. And
okay.
don't know what that cost was or what it meant. But
That's all I wanted to add to that.
All right, so Stephen, CJ, you could look into what that cost is so we can compare that.
We'll have that.
Randall?
If I may, Madam Chair, Randall Downey for the record. On a related issue in terms of searching to help improve the consumer and the EEF experience in the enrollment process, the difficulty is in trying to locate prescription medicines being covered by each of the plans too, and in what fashion. Would it be possible to adopt a program similar to that used by Medicare, where you could input the prescription medicines, dosage amount, how often used, create that list, match it against the plans, and also show pricing so that individuals and families have a much better idea of what kind of out-of-pocket costs they may be facing given coverage in any particular plan. Currently, that search engine allows you to look up to see if a certain drug, generic or brand or otherwise, is covered, but it gives you no pricing information and really it's a limited value to consumers, and you have to do it one by one. It would be much easier to input a list. You could limit it in a certain fashion. Medicare limits it to 25 medications. But then match that list run that against plans so that people have a much better idea of the cost factors they may be facing as they proceed.
CJ or Steve, was there ever any consideration for something like that?
Yes, there was consideration for a cost calculator, for the record, CJ Bowden, and that cost calculator is still to be developed and put in so that they can look at what the out-of-pocket costs are on a basis. They can plug in information. That was supposed to be an October 1 requirement, and that was pushed back. It is still not in there. We would have to check with Xerox and to see what their ETA on producing that is.
All right, thank you. All right, then the next item I wrote down had to do with Medicaid and the issue of the health plan options not appearing once the individual, and this was in the Laughlin and Mesquite example.
Dina Schmidt for the record. So the system was designed dynamically to actually remove those options because they are not available in the Medicaid. So the two HMOs are only offered in Clark and Washoe County. All other Medicaid recipients receive fee-for-service, and so based on the client's address, it provides them with the appropriate choices. So what you're seeing is correct because the HMOs are not available in those areas.
Isn't Laughlin in Clark County? And Mesquite for sure, yes.
And we can check, but the data is, it's supposed to be based on the information provided by Medicaid as to what addresses those are available. If it's incorrect, we can certainly have it. We can look at that and see if there's a system issue, but it should be doing it dynamically.
All right. Randall, is it maybe appropriate to give some zip code examples?
That'd be perfect.
Because some zip codes do cross county lines, but
Certainly. Actually, it only arose in the Laughlin area, and the zip code there would be 89029.
Okay.
Actually, it also occurred in Mesquite. Not a single Medicaid application. Sorry, Andres Ramirez for the record. Not a single Medicaid application in Mesquite
if you're not using your mic.
generated a Medicaid option. We know that the entire city of Mesquite is within the legal area, the legal boundaries of Clark County, but we also know that, as she was mentioning, that the service area for these HMOs does not include Mesquite or Laughlin, even though they are legally within the Clark County boundaries.
Yeah.
But the service areas are outside of the metro area. So of all the Medicaid people we enrolled in Mesquite, there was never a plan that ever popped up. We could never select one. We had to call over the phone and manually do it.
So Dina Schmidt, for the record, I will follow up with Medicaid to clarify those areas, but I believe it's based on their information and, like you said, the service areas, but I'll verify for sure.
So maybe the service areas are by zip code rather than by county? Okay. Yeah, if you could help out on that, it'd be appreciated. Then the next item I wrote down was providing some kind of roster of the open accounts that would be potential to assist with during this special enrollment period, specifically in 9, the border towns. CJ, is there any, I've heard this talked about, I don't know if we made any progress on getting rosters available.
For the record, CJ Bowden, on this specific issue, it was brought in front of the Consumer Assistance Advisory Committee about releasing personal information from individuals to brokers, navigators, and EEFs. And the Consumer Assistance Advisory Committee felt that that was not the correct method to go. And the information was not released on pending applications. The reasoning behind that would be if a person started to sign up with broker A, and they didn't complete that application, and we did not want to give that information out to broker B or C, giving it to somebody else. If a person had already started that application and was working with a person, we didn't want to randomly give those out to different individuals. We wanted to make sure that broker A had the ability to go back, contact the people that they had worked with, and finish that enrollment.
Thank you. Does broker A have a roster of applications that are outstanding?
No, not if it didn't
None
go
have.
through. If they had a problem where their application failed out and didn't go through, because most brokers are not using the broker portal because of the broker portal problems, then there was no tracking of an NPN number to that person until they submitted the paperwork after a closed enrollment, after the enrollment was complete and they submitted the spreadsheet to Nevada Health Link. But before that, there is no way to track that back to an individual broker.
So that goes back to the functionality of the site, not adequately tracking the broker.
That goes back to the root cause of the broker portal, not allowing individuals to access their accounts after they were signed up by a broker. Hence, brokers were made to use the individual portal instead of the broker portal to sign up individuals.
Okay. And is there ever, for the navigators and EFs, is there any way to track which organization assisted the person? Or is that the same problem?
All of that is manual tracking. We've asked each EEF entity that was out there to keep a list of HIX ID numbers of individuals they're working with. So if they got through the original account creation process and received a HIX ID, then those individual entities have those numbers, so we could go back through. But if that agency did not track, we've had a couple agencies that did not track their enrollment, then we would not be able to find that.
Any other comments?
Madam Chair, it's Art
Randall
Ramp.
Downey for the record. We did track those. CJ, I believe they've been submitted to you, but personally, I did not keep personal information from those individuals or families that I was assisting. So it's difficult, if not impossible, for me to follow through. And again, if you can, we always listed ourselves as the EEF assisting the client, and they were given a HealthLink member ID number. If there is any way that database could be searched to look for still open accounts, we'd be more than happy to have them referred back to us so that we can complete the process.
Art Ramp for the record. So we've asked brokers to, when they submit their list of of HIX IDs and members that they've helped, when they submit that to the Nevada Health Link, to also send that to us. And what we're finding is that the records aren't updated, even though those lists are being sent. The brokers a few months ago were pretty good about every week sending the list to us and sending them to the Health Link. But then when there was no action taken on it, they stopped sending the lists. You know, if you're taking the time to do the work, nobody's doing any follow-up on it, you know, it's kind of disheartening and you kind of lose focus on that. But so just so you're aware, we have asked for that from our brokers, so that's the only way we can pay commissions is to know who they were working with, and we take their word for it that they worked with that person, and list them in our system as broker of record. But what we're trying to do is work backwards to the Nevada Health Link to get the master database updated so that it doesn't overwrite coming back into our system as no broker of record. That's one of the challenges we face on my side.
This is Grace Butler, for the record, and if I could just comment on what Art is saying, that as a broker, we would update our lists every week, but sometimes that the list would get bounced back to us, that the email box was full when we had to submit them to the broker email. I mean, we had numerous, and then there were different emails that we were constantly, so I think there's a lot of confusion in that. So I think we try, but I think that there's just so much that when it keeps getting bounced back, it's frustrating, I think, on everybody's part.
So am I understanding the current situation that the burden is on the broker to send a list to the carrier of accounts that they enrolled? The carrier updates their system with that broker of record so that commissions can be paid, and then an update from the exchange on the enrollment kind of steps on that broker record potentially. Am I understanding that right?
Madam Chair, for the record, CJ Bowden. The process, a manual workaround was put in place when the broker portal went down, and the process should be the brokers send in a manual spreadsheet at the end of each week that includes all of the individuals' HICS ID numbers and their national producer number at the carrier that they signed them up with and the plan that they signed them up with to producers at nevadahealthlink.com. That is directly to Xerox. So the information should flow to Xerox. At that point in time, Xerox is to take that information and cross-populate their 834 enrollment data. So if we get enrollment data for a person and they have made a payment, it'll be sent over on an 834. When we get the information in from the brokers, that is supposed to be sent in a separate 834 or the original 834, depending on timing of when we get that information. And that would go to the carrier on the 834 transfer and automatically populate the carrier's database with the broker's NPN number so the carriers know exactly who to pay for that enrollment. We are finding now that we'll discuss that more in agenda item number 6, but we are finding that the information for the most part is at Xerox for enrollment and tying individuals to NPN numbers, but that information is not leaving Xerox on an 834 and going to the carriers.
All right.
This is Grace Butler again, sorry. I have a lot of opinions. In regards to that, on the spreadsheet, it just says date assigned, client number, their number, broker number, and our NPN. It doesn't have anything about plan, carrier, any of that. So maybe that might be a missing link for us to put the carrier information to sort through it so that it could go, because it's been kind of odd to me that that's never been asked, anything more than just the client name and their number. It hasn't ever been anything further than that, so that might be a good way to actually get that information sorted and get to the carriers appropriately.
In a perfect world, and for the record, CJ Bowden, by contract requirements, Xerox is required to track it without you sending a manual spreadsheet in. So once they fulfill the obligation of the contract and produce the broker portal that functions, it will automatically populate the information with the plan and send it over on the 834. So that is a contract requirement, but we're using a workaround system that's been devised right now.
For the record, this is Andres Ramirez. I explained that that is the way the process works for brokers, but it works different for navigators and EEFs. So through our responsibility, once the portal went down, we were responsible for building an Excel spreadsheet and then reporting that content information of client and HIX ID on an Excel spreadsheet on a monthly basis to the exchange, and it was submitted to them. I want to just mention that the way, at the beginning of this process, EEFs were also given a consent form that we were asked to have each client fill out, which asks for their name, their signature, and an EEF, and a HIX number, essentially authorizing us as EEFs to be able to complete their account. In the tracking process of this, though, that became somewhat problematic because I could enroll John Doe, have them fill out a consent form. With the updates that happened through this portal, their account was now corrupt. I had to recreate an account or work with Xerox online to fix that account. Many times that account was deleted once or twice or 30 times or sometimes, in some cases, 15 times before that account was fixed. So that HIX ID that we have on a consent form and that we put on an Excel spreadsheet versus what the final HIX number is on their final account don't always match up. And so proper auditing for consent forms and data we kept versus what the final information for a client is proves to be somewhat inconsistent. And that was certainly a challenge for us trying to figure out, okay, well, we have these consent forms that were signed, but we've had to change this, and now we have to track to find out what this new information is to properly report and be accountable for the amount of enrollments we did. That's still an issue, so we still have to recreate accounts. Currently, there are people whose accounts are still corrupt in the special enrollment period who are contacting us. There's a process that was put in to expire accounts and re-enroll them. That's not always working 100%, and so we have to get on the call center and figure that out. But again, we already had an existing form we were required to submit that now essentially is invalid because it's not going to match what that person's final enrollment information is. So from our standpoint, as you guys as the board and the NHL staff is supposed to do their job to evaluate us, it puts us at a significant disadvantage to accurately report the people we enrolled.
Thank you. Stephen?
Well, actually, and just Stephen Dente for the record, a potential solution for that problem could be to just add a field to the consent form that says, two fields basically, one that says initial enrollment HIX ID or initial application HIX ID and final application HIX ID. So if there's any different, it would be entered in the second field, but that's something that we can do at the exchange.
Do you think that would solve that particular issue? Okay.
If I could, Randall Downey for the record. CJ, the difficulty is, and Mr. Ramirez just, I think, alluded to it, is that we initiated a process with a consent form. We received the HIX ID, encountered an error, asked the people to come back. We assisted them again, maybe had to open a new account, and we're told when calling HealthLink, open a new account so that we have compounded the situation. And again, we reported people enrolled. Okay, we did not always report people not enrolled. And by and large, in the early moments of this process, those not enrolling far outnumbered those being enrolled. Many of those are still inactive. We were able to contact a number of those families and or individuals. Many of them found other ways to obtain coverage or were able to complete on their own. More power to them. However, that still leaves a large number of individuals and families hanging out there without coverage who made a real attempt to try to obtain coverage for their families. How do we obtain follow-up information? Because if they did not finish the enrollment, we were not submitting that information to you as people being enrolled. And because we did not wish to violate HIPAA, we did not maintain complete files on those individuals in order to be able to easily pick up 2-3 months later and pursue the case.
For the record, CJ Bowden on that. I know Xerox is supposed to be sending out correspondence to the individuals that have not completed enrollment or have not paid for a plan. There are a couple of groups. We need to see exactly where they're at with that, but the language in the request to complete the application is supposed to state to return to your broker or EEF that you worked with or come back to NevadaHealthLink.com. So that's the process going forward, and as soon as we see the notices sent out from Xerox, we'll be able to know if all of that information was contained in there, what it's supposed to be contained in there.
All right, thank you. Just as an FYI, the lights in this room are not flickering. But clearly on the monitor down here, it looks like they are. So I don't know if there's something about to happen with our video or not.
Hopefully not, but if we can go through, we'll continue to go through, because actually the sound sounds very good today.
Yes. One thing or the other. So with all of this, I think that we heard one modification that could be made to the manual process that may be more complete. The second is, I'd be curious on Xerox's schedule, if they have one, for actually fixing the broker portal so that we don't have to rely on these manual workarounds. Not sure if either you, CJ, or you, Steve, have any definitive information on that, but definitely seems to be key. And then getting the communication from Xerox about their outreach for the special enrollment. Was there any consideration by Xerox? Are they just sending out a list of all the brokers and all the navigators and EEFs, or just a general statement? You contact the person or organization that you worked with initially. Do you know?
For the record, CJ Bowden, at this point in time, I've been told that it is a general statement and not a list of brokers or agents, and the people are asked to go back to NevadaHealthLink.com if they had enrolled there.
All right. And this sounds like it's a very good solution for this special enrollment period.
And Manager Brian McEvely, for the record, obviously the challenge is, and we can all read the paper and we can all follow what's going on with the exchange board. I know a final decision has not been made, obviously, yet on what they're going to do or not do with Xerox, which obviously begs the question, and not just from the broker standpoint, navigators, I would assume Nevada HealthLink staff, can we really expect anything to be solved until, I mean, going forward, whether it is at Xerox, is it Deloitte & Touche, is it whoever, is it the guy in the basement that happens to be an IT genius, I mean, whoever it is, will any of this actually be solved? Because if you're Xerox, let's be honest, you don't know if you're still going to be around in 2 weeks. And to be fair, they haven't proven they can solve the problem even if they were. So these are all legitimate, and I know the Nevada HealthLink staff deals with it every day. Until they have a final solution as to who is going to be the entity going forward, can we really expect anything on this or not? And I don't know the answer to that.
Well, as one board member, I think that we keep operating as if we have Xerox until we don't have Xerox. They're still contracted with us to provide a service, and they have a responsibility to do so. Whether or not that changes their responsiveness or not, I don't know. But we can't really afford, the way the timing of any option is, we can't really afford to wait until some decision is made. I think we need to keep moving forward with what we have until that game changes. So that was part of the challenge, frankly, on scheduling this committee, because you don't know what direction you're headed. So the final decision really was keep going with what we have and try to make the best of it.
So, Madam Chair, Andres Ramirez for the record. I would just like to note that we definitely need to figure, from my perspective, either the broker portal needs to be fixed, or we need to figure out, or if there's a new solution, that needs to be added as well. What happened when the broker portal was put down is essentially all of us were using the main general website, which as brokers or navigators didn't give us any extra access or help to resolve an issue in application than the general public. All we were doing was logging on just like everybody else. And so oftentimes people were coming to us expecting, oh, well, you're a navigator. You must have some special access to the website that we don't have. And certainly under the portal, we did have some extra privileges that we did without the portal for those of us who it worked for. But I would certainly like us to be able to have greater functionality as navigators, and even for brokers to be able to solve issues or overcome technical errors that pop up, so that we're not reliant on having to call a call center or Xerox for every little minor thing that comes up.
All right. I think that's a number one priority from this group about determining where it is and getting fixed, and if it's not urgent enough, or not, that's not the right way to put it, if it's not high enough on the priority list, to work with the exchange staff to see if that can be modified. Exchange staff, I'm sure, is balancing lots of issues out there, so wouldn't want to do it in isolation.
This is Grace Butler for the record.
And on the
Sorry.
next item is the qualified life events. Easy access to exactly what those events are that do qualify for special enrollment, and if there is any option other than going through the call center to effectuate those enrollment changes. Now, I know that this should have been in place on October 1st, and I personally have heard many different answers from Xerox about when this is going to be available. Steve or CJ, do you have any update from Xerox on that?
For the record, CJ Bowden. Currently, we have a workaround process, and for qualifying life events, all individuals must call the call center to have a manual process done. And right now, that includes individuals that are currently on a plan and want to add a child, or individuals that are on a plan and want to cancel one person off the plan. If it's a family plan, there are issues with that, and they have to call, cancel the original plan, start a new plan, and we work together with the carrier to carry their accumulated deductible and out-of-pocket maximums over to the new plan, because it's not really a new plan. It's just the same plan with minus or plus a person. So those are difficulties that are there, but everything has to flow through the call center. On the posting of information, we have information posted on the website, both Nevada Health Link and exchange.nv.gov, on the list of qualifying life events, and those lists are listed directly out of 45 CFR, the regulations that regulate the qualifying life events for the exchange, and all of the information for each of the qualifying events is actually posted there. It may seem to be a shorter list, but though we do list every one of the qualifying life events and what the triggering dates are for those qualifying life events.
All right, we'll look for that. To the functionality of the qualifying life events, do we know of a time frame that Xerox is now targeting to have that working?
Madam Chair, for the record, CJ Bowden, I'm not aware of the current time frame for QLE completion.
Okay. So out of this, I think we'll have a list of questions for Xerox as well, so that we can report back what the planned implementation date is.
Art Ramp, for the record, not to beat a dead horse, but just from what you said, CJ, I want to make sure everybody understands what a challenge that creates on the carrier side, because that plan has to be canceled, re-entered. Like you said, all the deductibles, all claims got to be reprocessed. You got to move them all over to a new plan. when it was just a simple change of a member, terming a member or adding a member or something. Some QLE that should have just been a very, very simple fix. I just want to emphasize the downstream work it creates for a manual process like that. Yeah, on the member side as well, because they've got to get new ID cards now, because potentially new ID cards.
I can appreciate that very much. So even if there is a manual workaround, at least having that piece working better if it has to be entered from the call center. Thank you, Art. And then the last item that I wrote down was pricing of the prescription drugs in a list display. If that is, did you answer this, CJ? You did answer this as part of the plan.
It's part of the, for the record, CJ Bowden, it's part of the cost calculator that will come up. You'll see average pricing, but you'll see the copays and deductibles for standard and brand name drugs and generics, and then specialty drugs. You'll see that information, but that is again the pharmacy search was part of the provider search. So both of those options were taken down and people are being referred back to the carrier's website. So if we bring that back, then that would be available at that point, and it would show if the drug was preferred or not and the cost of copay for that drug. The other portion, while we were on break, I was able to get a hold of somebody at Xerox, or while we were discussing other things, and it was approximately $2,500 per update for the update of the provider cycle, and then another $2,500 per update for the pharmacy search tool.
And CJ, this is Leslie. That is the cost from the outside service or the Xerox expense?
That is the cost from the outside service to Xerox. It would be passed through to the exchange because the original contract contained quarterly updates. So the contract has 4 of those per year in it, and then anything else that would be a change in contract. So monthly would take that up to 12.
Art Ramp.
Chairperson, if I may, Brian McEvely for the record. Just going back to what we were talking about earlier when it comes to just a simple provider directory. And once again, this is going to sound incredibly simplistic, and my apologies, but $2,500 to add a link to the carrier's website that's interactive anyway. I mean, I can add a link to my own website in less than a minute. And once again, I'm not Xerox, but we're not asking them to recreate the wheel. We're not asking them to cure cancer. It's simply adding a link. It's a pass-through situation. Carriers have really already taken care of the hard work. They update it every day. I send clients to sites all day long. And what I'm saying is nothing no one hasn't thought of, but that's incredulous to me. $2,500 to say, here, let me copy and paste this to this. They're not creating anything. They're already there. That's stunning to me, but what the heck.
Art Ramp, I got 2 questions. One, CJ, is that per carrier or just per update? Or did they qualify that?
We've been told that is per update, not per carrier. And what that is the search tool. It's a third party that has the search tool and maintains the functionality of all the carrier plans and provider directories, as well as pharmacy plans as well. And all of those are combined, and they charge $2,500 per update for the entire system. So right now, we do have the capability, and we have it linked directly to the carriers. So each individual carrier, a person can go out and see who is there. It's just not searchable. If we brought the searchable tool back, that would allow individuals to search by a prescription or search by a provider and only show those plans that contain that prescription or that provider. But it's per update, and that includes all of the carriers.
Okay. And Chairman, I was able to confirm that St. Mary's does have a searchable directory, but it's one thing to go to stmaryshealthplans.com, search for your provider, but there's no way to bring it back into, other than a manual freeform text entry, back into the enrollment form. So it really needs to be built into the enrollment form to search and add the provider from there. It doesn't seem like it's that difficult to go to another website, pick a field, and then bring it back in. But in actuality, it is pretty difficult because you got two different systems talking to each other. So it sounds easy, but in practice, it's a little more challenging. That's why it needs to be built into one system.
All right. Still needs to go on the list, obviously. Maybe some smart technology people can figure this out. All right, the next item on the agenda is 4B, which is a discussion about specific functionality on the payments and the confirmation of payment. We as the board have heard quite a bit about this. I've never had a clear picture in my mind about how much of it, what percentage of the payments are in question as a result of all of this, but certainly a big problem when it is a problem. So open it up for discussion about what you are seeing from your side on payment and the confirmation of the payment.
This is Grace Butler for the record. If I could talk a little bit about this piece of it. The first piece that I want to talk about is more than anything, I think the APTCs and the CSRs. It kind of goes with Part A as well as what we're in with Part B, that it's part of the functionality, but I've had to where clients have enrolled and one day they have a $300 deductible because of their CSR. They'll come back the next day and enroll, and we'll sign them back in, exact same everything, and now their deductible is $3,000. So nothing that is changing with that, but that all of a sudden it's just one of those mysteries in life that's happening on the exchange. So, and I'm seeing it happen more and more. And sometimes the APTC changes. When I've called Nevada Health Link and have talked to the broker hotline, I've just heard that's a glitch in the system. You'll have to re-enroll. And so it's a very frustrating thing. Sometimes and it's just is a thing where we're getting different numbers every time we enroll, even though their job hasn't changed in 20 minutes or any of that. So that's one piece of it that's part of the first part. And then also in regards to payments, that this again links to the APTC, where we have clients who will get a $400 APTC and then all of a sudden it's gone, and they'll make a payment and it'll still show that they're not getting that APTC and that's just gone. Or payments will get, if a account, if we had to recreate an account, payments will go to an old account that isn't even active. We can only do our best to tell our clients to make sure to put their HIX numbers on, to make sure that they are doing the correct amount. But by the time that it actually processes, we hear, I don't know why it's doing that. You'll just have to redo it. So that's the frustration on our end of what we're hearing and what's happening with payments, that it never seems to anything consistently.
Can I ask a couple of questions on that?
Sure.
When either the APTC or the CSR changes, is that from the point that you think you have completed the enrollment and the next time you look it up, or the next month's billing? What's the time frame?
So usually, and I'll tell you, it happened to me today because we have someone who's in special enrollment, and last week we created everything we've started, and it ended up that we had 300. They came back in today, and now it's 3,000. So there really isn't a rhyme or reason to why it's doing that, but it is absolutely after we've completed it and we're now searching for plans. So it isn't a process of we're just looking. We've done all the homework of income, household verification, all the certifications under perjury, the whole deal, and we're looking for plans. So that's where it changes. And even today's scenario, just because it's fresh from today, when we picked the $300 deductible, last week it was $157. Today, that exact same plan was $158 for the $3,000 deductible. So the dollars changed, everything changed within that. So it's very confusing, and it's difficult to go to our clients and go, well, I don't know.
Andres Ramirez for the record. Just want to confirm that I understand what you're saying, and it's consistent with ours. So you'll get one amount when you get to the eligibility page where it says, here's what the APTC and CSR amount is. But then after you've picked your plan and you go to the payment portion, it'll sometimes change the APTC and CSR amount, so the payment comes up different of what you were originally expecting when you got to that point.
That is
Is that
true. But
correct?
that is true, that part of it. But then it also changes from when after that, I know which piece you're talking about where it shows all of our check marks and what we have for the APTC, and then you go to the next page. The next page will show it totally different. And that's where I'm saying that it isn't anything that's consistent that shows, again, there's no
So
reason.
during the same encounter, from one page to the next, it'll show a different amount?
It's usually the next day. It's usually, I had one client that I called, hey, here's where we're going and come in tomorrow. And he came in and everything changed and I go, okay, that's awesome. So yeah, it's one day to the next. It isn't necessarily page to page. It's usually when you log out and go back in.
Madam Chair, Andres Ramirez for the record. For us, it does happen during the same enrollment itself. We'll be in the middle of the process and we'll have one price on one screen, and by the time we're 2 or 3 screens later, the price has completely changed because of changes in APTC. The other thing I want to make sure that I bring up that we've had at least on several occasions is we'll get through the whole process. The client will have paid, their account says 0, but then they'll get notices from Xerox saying they haven't paid their full account, therefore they're still pending. And so the amount, when we call Xerox to talk to them, the amount that they're supposed to pay on their plan when you talk to Xerox has a completely different amount than what their screen is showing. So we'll log back into their account and we'll say, we've made a payment, we're looking at their screen, I'm on their account says balance due 0. So what do we owe? And they will tell us, well, we don't know why you see that, because from our screen, we see he still owes $50 or $60. And so that to me is a bigger issue that we need to figure out. Why is it that the Xerox screens view something completely different than what we and the clients are viewing on their screens?
Madam Chair, if I may follow up, a complementary problem, and thank you for that because I've encountered that too many times to remember. A complementary problem is that we've submitted payment, it may show payment balance due 0. They get a notice for the following month's premium. It says you have no subsidy, so all of a sudden it's charging market rate, and it's also indicating that we never received your first payment, you were therefore late, and it doubles it up. I don't know where the functionality problem is, whether it's with HealthLink or through the Xerox system. I don't know who's responsible, but far too often I've had panicked people coming into the office, or I'm in Pahrump and they come back in for the 3rd time into Pahrump. We were all set to go. My children need to go to the hospital. What's going on? I have no answer. I call the call center. We don't know what the problem is. Start over.
Maria? It has to be green.
For the record, this is Maria Gutierrez, and I want to second and third what you're saying. It's the same thing has happened with my clients where they will send a payment, and we have the subsidy, and I've actually just gotten into the habit of getting screenshots for most of the stuff that we do because when I do speak with somebody with Nevada HealthLink, they'll say, well, do you have a screenshot? Can you send that to us? Because the system is not showing that they have a subsidy, even though it clearly stated that, and thank goodness I have the rate sheets and everything available, but it does create a panic.
Ms. Gutierrez, could you please speak into the microphone?
Because the subsidy is not,
Thank you.
is not reflecting, and, okay. So that is something that I was looking for clarification on. And another thing is if a person has made a payment and let's say the subsidy wasn't showing correctly on the website, is that going to be audited where they should be making the correct amount of subsidy because of the fact that the calculator has not functioned for quite a while? Is there going to be an audit done on that, or is it that we have to personally go back and redo all of these applications because of the system's not functioning right with the calculator?
CJ, do you know about that last question?
I actually couldn't hear that last portion. Could you please repeat that last bit?
Move the face to about where your tablet is.
Maria Gutierrez for the record. My question is if there is going to be anything done with people that made payments according to what was showing up as their subsidy or their APTC, and there were errors in the calculator when these things were processed, or is it something that they have to go actually back and redo their application to get the corrected amounts? That is my question.
For the record, CJ Bowden, there's a couple of different things. We just had the audit come out from health benefit audits, and that audit came out with information that there were incorrect determinations of APTC done and incorrect determinations of CSRs done for individuals. So they're going back through and identifying all those issues. Here very shortly, we'll be sending out notices to individuals that had APTC incorrectly applied to catastrophic health plans, and individuals that had APTC incorrectly applied to dental plans that were not child essential health benefit dental plans. So those individuals will receive the information that they received APTC, and the exchange is working with the Nevada Division of Insurance to see the ramifications to both the carriers and the individuals, because they were granted APTC through the application process, yet they did not qualify for it for those plans. So the federal government will not pay out APTC on their part. So they will not have a tax liability, but their premium will be different. So we're looking at those issues right now, and then issues for individuals that received an incorrect APTC determination. If it is not in their favor, if it is granted that they received more APTC than they were eligible for, we need to reach out to those individuals if we know that those individuals received the wrong calculation, and make sure they come back to do a eligibility redetermination. But if we do not have that information, then we need a way to audit and find out exactly how many people are in that category.
CJ, this is Andres Ramirez for the record. What about those who should have had a higher APTC and didn't get that? Are they going to be credited that amount?
Yes, they will be credited. For the record, CJ Bowden. At the end of the year, when they file their taxes, if we do nothing at this point in time, they will receive it back on their federal refund because they have overpaid for health insurance, and they will receive it in one lump sum when they file their federal taxes in April of the following year.
Brian McEvely for the record. Madam Chair, actually, and this might be a question for CJ. The flip argument to that, dovetailing off that, the individuals that obviously throughout the year their own financial situation changes, raises, increases, lose their job, whatever, with the challenges that people have that was mentioned before, simply adding or subtracting a dependent, for example. Somebody goes from, $25,000 a year to 12 or whatever, or they make an increase. Is there the ability for that person on their own to go on and make those changes? Not the ones that were caught, the ones that just their circumstances changed. They don't want to have to, get into an IRS difficulty and end the year. Can they make that change, or are they going to have to start the process over again because of what's happened financially?
For the record, CJ Bowden, those individuals will be able to make the changes. That would be a qualifying life event. If a person loses a job and loses income, then they can call up and do a new application and determination for possibly Medicaid, say if they drop down to $12,000 per year. For those individuals that go the other way and get a promotion or go on to another job where they are earning more, it is the individual's responsibility to contact Nevada Health Link and go through another redetermination of eligibility manually so that we can update their profile and update the APTC that they are granted so that they're not in a hole at the end of the year. And that is very pertinent to those individuals who go over the 400% APTC mark because they would be forced to pay back any and all that they did not qualify for. So it is upon the individual, and it is stated multiple places in the application process, that if your information changes on your application, it is your responsibility to contact Nevada Health Link and go through a redetermination.
Art Ramp, CJ, does that require a new application? You said redetermination. Does that mean you have to term the old policy or the old enrollment and create a new one?
For the record, CJ Bowden, at this point in time, no, you do not have to terminate the policy. That is a billing change, and the billing change would just reduce the amount of APTC if they went up in income, and they would have to pay more on a monthly basis out of pocket. So for individuals that go the other way, they would be paying less out of pocket, or they would term their policy and move on to Medicaid depending on the cut in income.
Okay, thanks.
Thank you. I think for the good of the group, if we could talk a little bit about what is being looked at for turning the billing over to individual billing over to the carriers, and how that may or may not impact the APTC and CSR calculations. CJ or Steve, can you speak to whether those, under the scenarios that you're familiar with, would stay with Nevada Health Link, or if those would go to the carriers?
For the record, CJ Bowden, on 410, the board voted to end aggregate billing through Nevada Health Link and open a pilot project with Xerox and a carrier to explore bringing them on to doing the billing and payment collection. At this point in time, there is not a single pilot put in place. All of the carriers feel that if there was going to be a changeover and a transition of billing, then it should happen for each carrier at the same time. I spoke with Xerox yesterday, Dan Green of Xerox, and he will be heading that billing pullout of Xerox doing the aggregate billing. That will still require Nevada Health Link or the web portal to determine APTC and determine cost sharing reductions. So the eligibility engine will determine the information, bring it back. The web portal will give the CSR and APTC variation. That information will be transmitted over to the carrier on the 834. It is in the third loop, or loop C of the 834. And right now, many carriers only recognize the first two loops of the 834. So that information, we have to work with the carriers and make sure that all of our information feeds directly to them before that happens. And realistically, looking at a billing turnover would be somewhere in the July or August timeframe to individual carriers. All carriers have a process in place except for Nevada Health Co-op that they will be able to take the billing. Nevada Health Co-op will have to work with because they are not set up at all to bill customers.
Do you know when the proposed plan would be brought forward to the board? CJ or Steve?
For the record, CJ Bowden, I do not know when the proposed plan is going to be brought forward. I asked Dan Green that yesterday, and he did not have a full schedule on that.
Art Ramp, for the record, just to add on, keep adding on to everything you say, CJ, but just to before the carriers can take over that billing, some things have to occur. And one of those is we have to have a full reconciliation of all the membership, and we have to have a full payment reconciliation. Because we don't want to take a mess. If it was, and I'm not speaking for other carriers here, but if it was 95% correct, we'd be okay taking that and figuring out that other 5. But where it is right now, there's still some work to be done before it's ready to be handed over to us. So, July, that's feasible. We possibly could do that if some other things are done beforehand.
Art, this is Leslie Johnstone. Do you, as one carrier, believe that the plans being put together with full participation by the carriers, and it wouldn't just come from Xerox?
Art Ramp, are you speaking about the pilot?
Well, it doesn't sound like I have my own opinion about the pilot approach. Whatever Xerox is bringing forward to the board about how to turn over, what steps we would go through to turn over the individual billing to the carriers. My question is whether the carriers are fully participatory in that process of developing that proposal.
From St. Mary's, we've had one discussion where Dan and a team came out about 3 to 4 weeks ago to just discuss financial issues. This was one of the topics, but we haven't had any other discussions about taking over billing.
Thank you. That's kind of what I was afraid of. So as one board member, and I know I'm not representing the entire group, Steve and or CJ, really anything that comes before the board, it's going to be critical that the carriers are side by side that yes, this plan's been thoroughly thought out and we're on board. So I would just express that as an individual board member. All right, let's move on to item 5. It's almost 4:30, so we have about 30 more minutes. Oh, I'm sorry. Yes, let's talk about any other additional functionality.
For the record, Andres Ramirez, one of the things we've been trying during the special enrollment period to help us, especially during the summer, is the shop functionality. And so several of our EEFs have tried to create sample accounts and actually try to enroll actual businesses during this process as well. And we're having lots of complications being able to complete the process going in as a business, creating an account. We can input all the information. We can get to picking plans, but when we have to publish the quote and get that process to the employer, to the company owner, we start encountering errors and can't complete the process from that.
This is Grace Butler for the record. If I could just say one
CJ
thing.
or Steve, if
Sorry.
you could speak to that.
For the record, CJ Bowden, at this point in time, I am not versed on shop functionality. I will have to look into that. And I believe Ms. Butler up here has some comments as well.
All right, thank you.
Thank you. Grace Butler for the record. I just wanted to add one final piece on this one on my end. What might be a good solution for the functionality for the brokers and the navigators is to offer some type of communication to the brokers and the navigators. Obviously, I speak of the brokers. So in the very beginning, when the exchange first came about, we were notified pretty frequently of changes or updates or that type of thing, but it's really fallen off since this whole implementation, probably in October or November. It's almost embarrassing as a broker that when I call the exchange and I have a question or something comes up, then I'm told, oh, well, that changed. Well, that changed. Well, that changed. It would be great to get an email or something from the exchange to say, here's what we're working on. Here's what we've updated. Here's the new piece. And here's for instance, the Pay Online portal is broken. And when we were contacting the exchange, it was told, oh, just use bill pay. Well, that would be a great thing to be notified that that's broken, use bill pay, anything along those lines. So I guess that on our end, that just to have some more support to have that communication via email would be a great thing like we did in the beginning.
For the record, CJ Bowden, we'll be very happy to provide that information moving forward, hopefully on a weekly basis. But just so that you're aware and the general public's aware as well, Mr. Dente down there will be able to attest to this as well. When we go in to do training classes at times, we find that there are massive changes to the system on a daily to weekly basis that we were unaware of as well. And functionality has changed without Exchange staff knowing. So as soon as we know that there are changes that are happening, many of the times the first part we learn about a change, maybe a build was put in place and that changed upstream or downstream functionality, is when a broker or agent or EEF calls us and says, why is this not working? Then we're back into the system and finding that out. We are not being communicated the effects of the updates that are being put in and the changes of functionality that are with the updates, but we will work very diligently to provide a weekly update of the things that have changed.
Madam Chair, Brian McEvely for the record. Just a quick dovetail. Andres brought this up a little bit earlier, and obviously CJ, Nevada Health Link, Steve, you guys know this, the broker portal and the challenges. Dozens of people who would call my office, for example, probably similar, and assuming there was some special way to enroll. And as it was quite, well, no, we're going to basically, we have to go on the same, in essence, the same site. Because they're finally happy to get through to somebody live, and obviously with the challenges, and there's no special way we can streamline the process. And I know, and believe me, and I know that's the goal of the broker portal. I understand that. And I know that's on the list to be fixed. Because that would, from the broker community, would have a huge impact, not only on the ease of the enrollment, but quite frankly, the number of brokers that get more involved in the process. Yeah, we can make this easier for you, which is basically what our job is, to try to do that. And when we have to go back into the general system and they're thinking they've already been on it for 4 hours and we can't help, no, we're going to, they're stunned. And like I said, I know the Nevada Health Link staff knows that. It's nothing that's reinventing the wheel here. So.
I appreciate that. Any other functionality of the web portal that we have not talked about? All right, then let's go on to the next item, which is number 5 on possible items regarding the broker and eligibility enrollment facilitators hotline and the email support. So under 5A, we have service level and expertise of the customer service representatives. Any comments? Didn't have to be all bad. But we wanted to hear from you about what your current experience is like when you do have to call Xerox.
Grace Butler for the record, sorry.
I'll be honest, the calling portion was never really productive or successful on our portion. When we called Xerox to get to a hotline, oftentimes we were given to a customer service rep who tried to replicate everything we did, came to the same errors, wasn't able to help us, then had to escalate us to a supervisor to then try and solve the problem and move it from there. So when we started on the calling process, that didn't work really well. We did, though, identify some key CSRs who were at a senior level who could help us, and we engaged more in an email relationship with them. So when we had a specific case that they knew, they trusted us, we tried all the traps and every possibility to try and fix this, and we couldn't fix this, that we could email them the situation, and they would engage with us over email and help us resolve those complaints much more efficiently and effectively than trying to get through on the phone. Even for us, we would still have to wait 30 minutes, 45 minutes, an hour, sometimes an hour and a half before we could get through someone on the phone to try to resolve an issue. So that portion wasn't that friendly or helpful to us, but the email communications, once we established relationships with them, that worked really well, and there were some good people who were actually able to help us get through the problems.
Before we have other comments, I have a question whether or not that continued to be the case after this broker hotline was established.
Yes, for us, we didn't even continue calling. We still had trouble getting through, so we would continue to email, and that worked out best for us.
Okay. Thank you, Randall.
Okay, Madam Chair, thank you. Randall Downey for the record. I would second everything Mr. Ramirez just said. One of the pleasures has been that the call times, when the broker hotline or the navigator hotline was first introduced, it was surprising to me, even though we were doing an end run around the system supposedly. The first day I attempted to do it, I was with a client. I had to wait 112 minutes the first time when I was trying to assist these. The client later went home, opened up her account, and was able to complete and pay and sign up and enroll fully. On the second client, it was well over 2 hours, and our office was closing, and I did not complete the transaction that day. Needless to say, that situation has much improved. Times are down to maybe 5, at the most 10 minutes in wait time. I'm not receiving that much expert assistance. Too often, again, the typical response is, I'm sorry, you need to open a new account, or we will open a case for you, but it may be 2 to 6 weeks before that case can be acted upon. That is not acceptable. We have been assigned, am I too close, too far? Okay. We have been assigned dedicated staff to assist us and have begun that email project, but we are new in that regard. I just recently forwarded to our assigned dedicated person 2 cases with individuals having billing problems or other issues, requesting that they step in. I've not been able to contact the 2 clients to find out if there was indeed follow through, but I can tell you I have received no reply. So I have no idea how the case is still outstanding. I'm going to continue to attempt to reach out to the clients and find out what the status might be, and I'll pursue it by other means if that proves necessary. But call times have improved immensely. I'm not sure that the help we are receiving has been of any value.
Madam Chair, Andres Ramirez for the record. I do want to add, I failed to mention, part of the problem we've had with the call center as well is that when we call, their records don't show us as EEFs or navigators, and therefore they say they can't help us because we're not listed as a client. And even when they do find us as EEFs or clients, towards the end of the process, we were then told, well, you have to be listed as an authorized proxy in order to be able to help your client, which is when we sign ourselves up and we would add ourselves as an EEF, that's not the same process as adding yourself as a proxy. And so as we were calling, we were told, well, we can't help you because you're not a proxy. Then we had to go back, we had to hang up, go back into the systems, add ourselves as proxies, go through that process, then call the call center back. So now on their screen, it would show that we were proxies, and at times, again, have to wait another hour and a half in order to be able to move forward with that. So that process as well was troublesome because the call center staff, and they're doing what they're told to verify that we're authorized to help this client, but even though we knew that we were assigned as EFs, we wouldn't be allowed to get any information to help our clients. I don't know if that was the same problem for brokers, but from an EF standpoint, that was something we had.
This is Grace Butler for the record. I do agree. I first want Andre's email addresses that he has. But other than that, it appears that even though I do like the broker hotline and it's improved immensely, especially as the months go on, one part that's frustrating is that every time you call in, you get a different answer. It's almost like calling the IRS sometimes, that you hang up and you call back and then they'll give you a different answer as to what the issue is with a certain client. It is very frustrating. There are some that are phenomenal to work with, and sometimes you just have to hang up and call back and hope you get somebody else that will follow it through instead of just providing a case number. And because I have a ton of case numbers that they'll say, okay, all right, this got escalated. This is now tier 2. And that's all it ever appears to happen. And when you call, when they say, we'll call you back next week, tomorrow. That never happens. And I don't have magic email addresses to even follow up. So it's really a luck of the draw when you make a phone call to see if you can get somebody who can help you to the next level and actually get an answer. And when you talk to somebody, there isn't a way to get to a supervisor that you could actually get something resolved when you know I don't know if I make any sense, but when you know that there should be an answer to this and you're just hearing, I don't know, it's a glitch in the system, reapply, that just shouldn't be the automatic answer. So I'm not just trying to say it's all bad. There are some very good parts to it that I do like, but these other parts that are the frustrating parts.
Yes, Maria Gutierrez for the record. And I do agree with like when I do call everybody, the staff is really nice. That's never been an issue. But we do go through the whole process of verifying who we are, and we're told that they need to get all this information because they need to properly notate the account so that if we were to call again in the future, they're able to see the notes. But that doesn't appear to happen because the client can call and I can call in every single time. They don't know what's going on, and then we have to give them a case number if the case was submitted, and then at the same time nothing is followed through. If they tell us one thing, and like for instance, in many cases we had issues with effective dates where because of all the problem errors with the system, we weren't able to get an account set up before the 15th of the month. So then we would ask if there was any way that the client's plan would still be effective that first of that month because of the issues we had. We were told constantly no. If since the payment is going to be received after the 15th, their plan will not be effective till the following, not this coming month. But that wasn't the case. People's plans became effective the first of that month. And that's what they had not expected that because we trusted that the reps were actually saying what was going to happen, and that just didn't occur. So them not having being able to give us the right information, and we trust them to give us the information, and then it turns out that they blame it on the system, but then nothing can be done on that end. And it has been frustrating getting those issues resolved.
Madam Chair, Brian McEvely for the record, just what Grace was mentioning earlier about when you called, and I've heard this from several brokers calling the hotline. Number one, yes, I agree with what Maria said. Much shorter wait times, much friendly people when you call. But I've heard this from numerous brokers where it completely depends, obviously, number one, on who you get on the phone. And number two, I know brokers that are literally asking for people by name because and that's really more of I think, a people issue than about a health thing. You can call an airline, you call an IRS, depends on who you get on the phone. But if the level of training, in essence, is the same for everyone, but yet, obviously, there are those that are taking the extra steps to not just say, okay, start all over, or we're going to magnify it to tier 2, hey, here's how you solve it. Because I know there have been issues that are being solved because whoever you got on the phone took the time to solve it. And obviously, if you're calling customer service, they all have the ability to do the same thing. But the experiences are a lot different depending on who you talk to. So,
Thank you. I'd be curious as a group if you are seeing any improvement in the call center level of service, not just in how long it takes them to answer the phone, but the accuracy of the information that they get and able to close out the issues. Is there any improvement, or it's remaining as you guys are describing it, the way it's been?
Grace Butler for the record. I don't see much improvement and this is just even today where the same thing is happening where you end up hanging up and calling back many times just to get, and like you're saying, the person who cares enough to help to solve an issue or to go to the next level. So I don't see much of an improvement. Yes, you call and you're on hold for 30 seconds now. It's beautiful. But it's kind of pointless when still nothing is getting resolved.
I'm seeing noddings of the head, and Randall is having a hard time with the microphone. There we go.
Okay, Randall Downey for the record. Frankly, I think we were all speaking in the present tense.
All right.
But let me point out that, frankly, I don't rely on the call center now, and here's why. The functionality of the system is much improved, and it's much easier now, even if we have an expired account, to repopulate, forge ahead. There's certain data that needs to be re-entered for HIPAA purposes. That's fine. No issue there. So frankly, the less I have to rely on the call center, the happier camper I am. And we're allowed to do so because, in fact, most times, currently, the functionality of the system is more than adequate to help us complete the enrollment.
All right. Well, at least there's a glimmer of good news there. Thank you. Any other comments about the call center?
Art Ramp for the record. I guess I should just weigh in from what we're hearing from the carrier perspective. We get members calling our member services department, similar things of what have been said here, that the information's inconsistent, or they're being told, even though this has been discussed multiple times in our carrier calls with Xerox, that the members are being told, well, the health plan has that information, call your carrier, when we don't have the information. And our question always is, how can the call center tell that we have the information? We've asked that question, and we don't. There's no real answer to that. And we've asked several times that the call center be instructed not to just have that blanket answer, call the health plan, unless we really do have the information. And but that's my 2 cents.
Maria Gutierrez for the record. With that actually is what I was going to say. When people have asked in reference to the dental plan summaries that are reflected in we call customer service, they're not familiar with these plans themselves. They don't know what the dental plans entail, what exactly they cover, and that has been somewhat frustrating because we would expect them to be more familiar with these plans, and they're not. And so they tell us the same thing, contact the plan carrier. They're the ones who can tell you. But in that moment that we're helping a person select a plan, we guide ourselves by the benefit summary, but it's somewhat vague in exactly how these benefits are applied. And I've had clients where they go and receive the dental services and are told, no, nothing is covered but the cleaning. But the benefit summary states that these other services are covered. But that's not what they're being told when they go to the dental providers. So I just wish that they'd be more knowledgeable about these things.
Now, the next item on the agenda we spoke to a little bit, but I would like to see if there's anything additional regarding the verification process of the broker or EEF as the authorized representative. I think it was Andres that indicated the call center could not, in all cases, verify that they're a legitimate navigator or EEF, and I wonder how that could even be. Does anybody have an answer to that?
For the record, CJ Bowden, this all relates back to the broker portal not functioning. With the broker portal, if a broker would log in and enroll an individual through the broker portal, their NPN number and their name is immediately tied to that individual. When we stopped use of the broker portal and individuals or brokers and EEFs were going through the individual portal to enroll people, there is no way to track an NPN number to a person, even though the portal asks if you're a broker or agent. And if you answer that with a yes, at the very first, you won't be able to go through with the rest of the application. You have to actually lie and say you're not a broker or an EEF to the first question. Then you move further into the application and you are asked later if you are. At that point, you answer yes, put your name and NPN number in, and that information just goes off into space. It is not tied to that account. We don't understand why that information is not tied to that account, and Xerox has not been able to answer that. So with those two things being said, when a person calls up, unless a spreadsheet has been sent in manually by the broker or EEF, there is no backside knowledge that that person is actually helping or assisting a person enroll. And the call center was instructed through their training, internal Xerox, that unless a person is a proxy on the account or the broker of record for the account, then a person is not to speak to anyone else about that person's account.
So if I follow that, it will track who has signed up as the proxy, but it won't track who signed up as the broker or EEF?
That is correct, yes.
Andres Ramirez for the record. So, sort of. The way you sign up as a proxy, you actually have to log into the client's account, go to their account settings, and then be able to add yourself as a proxy. In that same process, you can also add yourself as a broker or an EEF going through their account settings. So if you do it that way, it will list you on their account as opposed to the page when you're enrolling and it asks you, are you an EEF? And it asks us to enter all that information. We can do that all day. It's still not going to show information. We have to physically go into the client's account settings, go through the portion and show. But not every EEF pops up on that database. So when you say add an EEF or add a broker, you click that button and it allows you to search for whoever's listed on the database of brokers or EEFs. So if you happen to be one of the lucky ones like me whose name is listed on there, then I could automatically assign myself as an EEF, and then it would show up on the call center's record that I'm a broker for that person. But if you were a navigator or an EEF whose name didn't pop up on that database, even though you had your NPN and your badge, then you couldn't add yourself.
Now, in terms of whether your name pops up or not, is it a situation of it is either there or it's not, or sometimes it's there and sometimes it's not?
Andres Ramirez for the record. It's either there or it's not. Pretty much every EEF and or broker was notified who was listed on the database and who wasn't. Essentially, whoever was able to successfully create a broker portal was listed on that list. And if you were never able to create a successful broker portal, then you were never going to pop up on that list.
Okay.
Randall Downey for the record. Let me state, in our organization, CARE, we have 10 staff who are listed as EEFs, but the only two names that ever crop up or HealthLink refers to are my CEO and myself.
All right. CJ or Steve?
Stephen Dente for the record. Yeah, and that is actually, like Andre said, a result of the broker portal being suspended and the secret code process that went to verifying a broker or EEF going through the appointment process with Nevada HealthLink, that being suspended as well. So that list is basically,
Frozen.
stopped. Yeah, that list stopped, and it's only including those who have gone through that process. The workaround for a broker or EEF getting through to the call center and being able to act on a client's behalf was to be included on the broker EEF master list, which is to be provided to all call center representatives to confirm that the person that they're speaking to is actually an appointed broker or EEF. However, like CJ said, it does not include any relationship with a specific client. That would only be achieved through the proxy. But that information that's been communicated to the call center, that to at least make sure that they can confirm someone through that master list, because that was not happening as well. So
Brian McKepley for the record. So Stephen, just actually to clarify, so if you're calling on a client's behalf and your name comes up on the list that you're verified and able to do that. However, as Andres mentioned before about proxy, you're not identified directly with John Smith, even though they identify you as, yes, you're a broker, or you're a navigator, you still can't ask the question, whatever that is, without being listed as a proxy on their individual account.
that was what the call center messaging was and has been for the last few months.
So
Yeah.
it's still the case.
Yes, yeah, and until there is a better way of linking the broker to that account, because we were all under the impression, brokers and exchange staff, that assigning yourself as basically through the question is an exchange enrollment facilitator / producer, helping you fill out this application by clicking yes, and then assigning, you're adding the producer name, information, contact information, license numbers, that was actually the assignment of showing the reps your information on the back end that you could speak on that client's behalf, but that was not the case.
Okay.
That was going off, that information was not being tracked. So
As of right now, it's still not being tracked, correct? Or
I don't believe so, CJ.
I didn't think
might-
it was.
Yeah.
Okay.
All right, so a lot of hanging on the broker portal being corrected and brought back up. Item 5C is the ability to solve issues through the broker EF email address. And it sounds like the workaround on that is to get a specific representative's email address rather than using a generic one. So Andre's got the magic list, so call him.
A magician never reveals his secrets.
Maybe the highest, well, I better not say that. All right, item 5D, additional support issues that would be important to the brokers or navigators or EFs. Besides getting the broker portal working and the correct answer from the customer service representatives and responses from the call center.
Well, I've mentioned this to some of the staff and at NHL and Xerox as well. So even if they bring back the portal as it was originally conceived, it still provided brokers and EEFs limited access to the system compared to what call center staff and Xerox staff happen. So there's actually multiple different portals. There was a portal they created for EEFs and brokers. There was a portal they created for the general public. And then there's a portal they created for CSR staff at Xerox. And all three of those were different. The CSR staff, again, were able to have extra functionality to be able to push through certain things that brokers and CSRs and EEFs did not have, even though we also went through training and certification. So, unless there's, I guess tiered errors or technical issues that I think would have to be limited only to Xerox because of sensitivity issues, that having a broker that allows us to bypass simple requests and so forth. Oftentimes, the system kept prompting us to provide proof of citizenship or proof of income or proof of this, simple little things, and we would just say, yes, we've submitted that, but the system at the end of the day was still forcing customers to email and so forth. The main customer center as opposed to us being able to override some of those settings. So having greater functionality for us who are going through the certification, I think would give us much greater ability to solve many of these problems and reduce the stress on the call center and Xerox so that they're only dealing with the most extreme cases or people who need the most help, and the rest of us can move forward to a larger group of people and enroll them.
All right. I see noddings of the head. Any other comments?
Yeah, I would. Brian McEverly, for the record, just dovetailing what Andres said, from purely from a training standpoint, and believe me when I say this is not meant as any disrespect to anyone in customer service and Nevada HealthLink, but if you're working, let's say, with a navigator with a level of experience here or a broker who's been doing this for 15 years, to be quite frank, I would think that would make Nevada HealthLink's life a lot easier if we simply have the same functionality, and with our background in trading, we can solve the problem a lot quicker without picking up the phone, without sending an email. Things we've been doing on a daily basis for years. And so, yes, you're right. Leslie, you mentioned this before. Solving the broker portal or the navigator portal solves a lot of issues. Because that's coming back and around a lot today. But then taking it a step further and okay, unless there's a privacy issue or something, but even then, we have the same HIPAA requirements that anyone else does. So Xerox can look at it, or a customer service. I'm not sure why a navigator and/or a broker can't literally do the same thing and just streamline the process.
All right. So expanded functionality from what it was originally designed to do. All right. Any other comments, questions, suggestions on broker support, navigator support? All right. Out of respect for everybody's time, I'm going to defer item 6 until our next meeting. And we will also try to bring as much information back as possible. If nothing else, Xerox's schedule for some of these issues to be resolved, and hopefully talk a little bit about what's to do, what preparations are underway for changing things with the next open enrollment. So CJ and I will work through an agenda. Generally, Thursday afternoon, this time, as good as any for the participants. All right. We'll try for maybe 3 or 4 weeks from now for the next meeting. Any other specific items that the committee members would like to be on the agenda for next time?
Andres Ramirez for the record. Nothing for the agenda, but if we can have it a little cooler in the room, that would be great.
It was freezing when we first got here. All right. But the audio works today, so we have one good thing going for us. All right. Anyone up north, any of the committee members up north have suggestions, comments? All right. Let's have public comment. Anyone in the south want to make public comment?
Vicki Mayville, for the record. One thing that hasn't been mentioned too much is the ability to change information like date of birth or address. That needs to be possible, and so far hasn't been able to be done. And I have a specific case that I've been told repeatedly, no way are we ever going to do that, and I'm like, yes, you are. We've got to change the date of birth, I'm sorry, and a mailing address. So that's one thing that I don't think has been mentioned really. And then secondly, I think you might want to have more than 3 meetings. I think you need to continue this dialogue further, if not with these people, with brokers and navigators going forward. That's it. Thank you.
All right. Then with that, I will go ahead and adjourn the meeting, and we will reach out for a good time for our second meeting to be held. Thank you all very, very much. Appreciate your input and candor.